Hi, today we are going to discuss about benign hypertrophy of prostate, benign prostatic hyperplasia, called as BPH. We say that prostate is a walnut-shaped gland and its function is to form a part of the semen. We know that the benign hypertrophy of prostate is very common in male and is the most common enlargement of prostate, most common, and it is usually that enlargement in 30 years and above. It usually doesn't occur below 30 years, but usually starts at 30-year age group. And we have that at 50 years 50% of men have it, at 60-year of age group 60% of males have it, at 80% of age group 80% of males have it. It is due to prolonged exposure to testosterone hormone. And now clinical features have been divided into three parts. We say that clinical feature of benign prostatic hyperplasia have been irritative symptoms. And so what are the irritative symptoms? Increased frequency, or a person is going to bathroom again and again and again, and it's irritative symptoms. And the second is urgency. He is going there, when he gets a reflux, he has to reach quickly to the bathroom, otherwise maybe it means urgency. It means urgency, that is, he has to avoid it quickly, otherwise maybe he will spoil his clothes or something. Nocturia is in the night, they have to go to the bathroom 3 and 4 times or something like that. Well, polyuria is when the nocturia plus polyuria is when they pass large amounts of urine during the night. But here the amount of urine may not be so large, but they have nocturia, they get a feeling that they have to void. And dysuria is painful micturition, and then we have hematuria, that blood in the urine. So we have another is obstructive symptoms. In obstructive symptoms, we have difficulty in initiating, difficulty in maintaining flow, and then we have dribbling, feeling of incomplete evacuation, acute urinary retention, and overflow incontinence. These are the different things. These are obstructive symptoms. And then we have sexual symptoms. Sexual symptoms are retrograde ejaculation and erectile dysfunction. And after that we go for DRE. In DRE, the gland is symmetrical enlargement of both lobes and no loss of median sulcus. Loss of median sulcus is a feature of carcinoma. When we don't have loss of median sulcus, this is benign prostatic hyperplasia. Symptoms may be same. Number one is in benign prostatic hyperplasia, both the lobes have become equally enlarged, and the enlargement is symmetrical. But in carcinoma, it is asymmetrical, and there is loss of median sulcus. Okay. We do PSA levels in benign prostatic hyperplasia. The normal PSA level is 4 nanogram per ml, and 4 to 14 is intermediate, greater than 10 is carcinoma, and greater than 20 is metastatic disease, metastasis of prostate cancer. Well, metastasis of prostate cancer, it indicates cancer. Wrong, but not what is wrong. And it means that if we have something between 4 and 14, we remember it, there is something wrong, but it may be normal, and intermediate zone to be confirmed by other investigations. Now, confirmation of benign prostatic hyperplasia is done by endorectal USG or by biopsy. And that's all. Thank you.